I've been involved in a consortium of trusts in the South Coast for the last few years, primarily in radiology, but also in order comms and other areas. And our main focus was to help the data follow the patient through the patient journey. A lot of our patients visit one trust or another trust. We have a trust in the Isle of Wight, for instance, refer a lot of patients to Portsmouth and to Southampton. And it was key for us to provide an information infrastructure, particularly around radiology, that supported the patient flow. So as the patient moved, the data was available wherever they went to. Previously, clinicians had to log into 3 or 4 different systems in order to see the whole patient record. And now we have a solution for radiology where in one place they can view all of the imaging and all the reports for a patient, regardless of where they've been seen across the region. And I think that's been very, very important for our patients. It certainly helped me personally and my wife in her treatment. And I can see benefits for a wider patient cohort. That is great for radiology, but what I want to see now is that expanding across the other ologies in the trust and reaching out to the community as well. I'm working quite a lot with the Isle of Wight right now. The Isle of Wight there is one hospital on the Isle of Wight that serves all 117,000 people that live there. They need much closer ties between the hospital and the GPs, because the GP, they are the people who have the legitimate relationship with the patient. They want to see what results are available for their patients immediately. We need to kind of break down some of the barriers that prohibit that easy flow of information between the acute trust and the GPs right now. There are still some vestiges of control within the NHS, saying acute trust kind of holds on to its data and doesn't permit GPs easy access to the patient data for somewhat kind of aging information governance rules, and I like to see those broken down. I don't believe that information sharing is a technology problem. It's not an information problem. I don't think we have systems that can enable that sharing. What we don't have is the will to break down the information governance and the organisational blocks in the way right now. If you ask a clinician, the chances are that the clinician will tell you that they kind of like the paper-driven workflow right now. At one of my hospitals, it is very much a paper-driven workflow. There are information systems behind the scenes, but the workflow is driven by the patient carrying a piece of paper with stickers on. And I think I would like to break down the relationship between the patient and a piece of paper and a clinician. I want the clinician to have the relationship directly with the patient and have easy access to the information they need to do their job. And I think getting away from paper, a paper is the instant it's printed, it's stale. Although sometimes clinicians will mark up on a piece of paper and they say, well, I can't replicate this with an IT system. Well, again, there are no technology barriers here. It is simply a business process re-engineering that needs to be done. And I think the benefits are for the patient in terms of clinical safety, easy access to the total patient record at wherever they are in a clinical context within the trust, and what else is there? Can't think of anything else to say about paperless apart from everybody else does it. Why doesn't the NHS? I come from industry where 30 years ago paper was only used by managers to communicate to other managers. The techies used electronic means to communicate and share and document. They changed. It took them a long time to change, but the organisation I came from, which IT information manufacturer, they went paperless donks ago. And I was personally at shows in the 1980s talking about the paperless office. They have adopted it. Why hasn't the NHS? I don't think there's any real reason why the NHS is not paperless now. There's a good collection of people. I see there's a really good turnout in terms of the CEOs, CCIOs from the trusts. I see some old faces from my journey through healthcare IT. So it's good to meet those people again and find out what they're up to. good to learn about the experiences of other people, and I think the presentations I've seen so far, they've been very candid, very honest representations of their experiences when they've tried to implement any EMR, EPR, and so on. I think there are lessons to be learned from the early adopters of the systems, and sessions like this is where you learn those lessons.